So we will continue. Thanks for having coming back again for the second session of the grafters. And just as a reminder, we have talking about class 1 and 2. We will continue class 3 and 4 briefly. Class 3 represent mainly horizontal resorption, because you know that you will never have one direction resorption. It's always a three-dimensional phenomenon with a dominant side. But as you can see from the slide, it is impossible to place an immediate implant. So by definition, our class 3 means delayed implants after regeneration / reconstruction. And class 4, the dominant component is vertical. So if you have this type of morphology, it's impossible to place an implant. You will lose it most of the time. And so you have to change local anatomy. And this is the ideal way I would like to do it, of course. And the same as regards class 4. So I would like to change the white lines into the green line. And these are the most tricky and difficult cases to be treated. Again, the philosophy doesn't change. We started when Paolo was still one of my students in 1994-95. We didn't publish for 10 years, but the idea was already ready at that time. And so again, prosthetic project, the only difference is that bone augmentation comes before the prosthetically guided implant placement, but also the bone augmentation is guided by the prosthetic plan. So every case I plan, I will do it always after his consultation. I never place a block like 40 years ago.